Hello, everyone, and welcome to another episode of Couch Conversations. Today we have Kirby with us. Kirby is a registered dietitian with a special interest in genetics and women's health. A big topic that many of you are probably wondering about is what are common nutritional shortfalls that you might not be aware of, and how can we address them? So today we're going to be unpacking that and tapping into Kirby's extensive knowledge and learning a few things. So Kirby, you see a lot of people, many women in particular, that are struggling, I guess, from energy dips, from hormonal changes. What would you say is the number one thing that people struggle with?
Right now, I'm seeing a lot of fatigue and brain fog, especially this time of the year. A lot of my patients are struggling with just trying to get through the day.
Yeah. So it's funny you talk about that, because we had this discussion the other day where I was like, what is brain fog? And like, how is that even a thing? And how do you diagnose that? And everyone in the office seemed to have a different opinion on what brain fog was. So maybe in your dietitian terms, you can outline what it is.
So brain fog is really, it can be a number of things. A lot of the time, my patients become quite forgetful. They have trouble concentrating, and they just feel like they have this lack of energy and they can't concentrate enough.
Sounds relatable.
Yeah.
So what is your advice then to people who are struggling with fatigue and brain fog?
So what I do in practice is I often check their nutrients. I always say test, don't guess, because we don't actually know what's going on unless we do. And oftentimes symptoms can overlap. And so it could be iron deficiency, it could be vitamin B12 deficiency, it could be vitamin D deficiency. We don't know unless we check. We also don't want to over supplement or under supplement, so we need to understand where that patient is at for us to be able to supplement appropriately.
Okay, and when you say test, this would be blood tests?
This will be blood tests, yeah.
And then how would genetic tests come in? When would you recommend someone does a genetic test?
So a genetic test, I always say it's like a luxury, but it's good to know. It's so good to understand your genetics, because then you'll know what you are predisposed to. And we know with genetic testing, or at least the testing we use, it's nutrigenomics testing. So it's how your nutrition and lifestyle and supplements can optimize your genetics. And so depending on if the patient is struggling with detoxification issues, if they are struggling with inflammation, they feeling swollen a lot of the time, or they're gaining weight, we will look into genetics.
Okay.
Yeah.
I read somewhere that your genetics load the gun, but what you eat, so your diet pulls the trigger. So I guess there's a lot you can change in terms of your nutrition that can benefit your genetics. Okay, so you mentioned vitamin D, you mentioned B12, you mentioned iron. So how would one know if they are, apart from the tests, like why would someone come and see you, and what would the warning signs be that they are deficient in those nutrients?
So for example, in my practice, I will see patients struggling with an irregular menstrual cycle, or they're fatigued, or they're struggling with sleep. They're not sleeping well, or they are struggling with sugar cravings. Then we'll know to test, okay, let's check your blood glucose, let's check your vitamin D, let's check your B12, because it could be a combination, it could be one, you're not sure.
And so B12 is obviously related to energy.
Yes.
And we know that people who particularly are following a vegan or vegetarian diet are often low in B12. Do you see that with people that eat meat as well? Is it because maybe we're not following a holistic diet?
It could be dietary. So oftentimes my patients think they're eating enough protein, and that's where you get most of your B12, and they're really not. And so we'll obviously assess their nutrition. It could also be that, again, if you look at genetics, there's actual genes or enzymes that can help you absorb vitamin D a lot better. So again, that would be a genetic issue, and we may need to increase the dosage in those patients. It really depends. And then again, it could just be stress, because we know B12 is also water soluble, so it can deplete very quickly in times of extreme stress.
Okay.
Yeah.
Okay. So a stressed person, what else would affect your nutrient levels when you're stressed?
So when we look at nutrients, there could be inflammation present, which could exacerbate their symptoms. There could be a digestion issue that could also exacerbate their nutrient deficiencies. Stress is a difficult one to manage because some people perceive stress differently, and some people can be extremely deficient, and some people can be perfectly fine in times of stress. It's very tricky.
So you mentioned blood sugar levels.
Yeah.
And I'm loving this because I got a continuous blood glucose monitor.
Yeah.
I won't take off my clothes and show you, but it's like a little white, and it's got a tiny little needle that goes into your arm.
One, actually.
Oh, have you also got one? So it stays on your arm for 2 weeks, and then I've got the ultra human ring as well. I'm very bionic at the moment, which tracks movement, sleep, exercise. And they've actually just allowed me to connect my ring with my blood glucose monitor. So I'm able to track a whole lot of things.
Yes.
And I'm testing everything, and it's a bit obsessive, and I'm loving it. But for example, I will do the same amount of exercise 2 days in a row, go for a walk in the morning, have the same breakfast, have the same lunch. Except on day 1, I didn't take berberine, and on day 2, I took berberine 30 minutes before my lunch.
Yes.
So I obviously had like a gauge of what my lunch, the same lunch, did to my blood sugar levels, and then the next day I looked again with berberine, and it was fascinating. My blood sugar spike, which we know you don't really want these big spikes and dips in a day, was much less on the day I'd taken berberine with the same lunch.
Yes.
So I love that because it basically validates the effectiveness of one of our products.
Yes.
But what is your experience with berberine? What other techniques do you use to manage blood sugar spikes? And yeah, I guess what's your input there?
So, of course, nutrition plays a big role. We want to make sure that the patient is eating enough of the right things to prevent those spikes. And oftentimes, depending if you have type 2 diabetes or insulin resistant, it may not be enough. And so we then look to those herbals like berberine or inositol to try and manage the glucose a lot better. So, for example, berberine is great for glucose control. It's great for weight management. It almost forces glucose into the cell, so it's just better in terms of long-term blood glucose control. So I use it with a lot of patients, sometimes in combination with inositol. It all depends.
Okay.
Yeah.
Amazing. So maybe we should just unpack, I guess, these spikes and lows for the consumer, because it's not always that easy to understand why you want to try and keep your blood glucose levels stable for, I guess, energy consistency and for weight management. So maybe you can dig a bit deeper into that.
Yeah. So I always like to show my patient this visual, so all of them know what I'm talking about. But how I explain it is, when you wake up in the morning, immediately your brain will register, oh, Laura's awake. And so your brain will start giving you glucose, because glucose is your brain's main energy source. And when glucose starts to increase, we know at some point, if we have delayed our eating for too long in some patients, that glucose can spike and then have an immediate drop. Now that spike and fall immediately triggers your brain, and your brain thinks, okay, so Laura's in trouble, we need to help her. And that response is, all your brain can do is tell your adrenals, give her cortisol, because she's in trouble. And so cortisol will come, try to balance your glucose. But if you're struggling with weight management, cortisol's main job is to protect you. And so cortisol is going to store fat around this area for people who struggle with visceral fat. And that can also lead to energy dropping. It could lead to sugar cravings. It could lead to hormonal issues, because now what we're doing is we're telling the brain, focus on cortisol. And so your brain will take all its resources away from producing too many other hormones. And then, of course, it's going to affect our mood as well. So we don't want that spike and dip long term. That's obviously going to increase our risk for chronic disease.
That then kind of is an argument against fasting.
Yes.
So, what's your opinion on fasting?
So let me start off by saying there's not a lot of research when it comes to women in general, but when it comes to women and then intermittent fasting. But we've seen many benefits of intermittent fasting. So it can work for some people and it just doesn't work for others. Mainly in my practice, because we're also so focused on hormone production, a lot of my patients struggle with a high appetite. And so we want to make sure they're having their breakfast, their lunch, their dinner. If someone is feeling completely fine, they don't have glucose spikes in the morning, they're feeling like they can go a longer period without food, then fine, we do intermittent fasting where we eat in a specific window. But oftentimes I find that people don't know what intermittent fasting actually means. And so they think, okay, I'll eat one meal a day and yay. But there's so many nutrient requirements that we need within a day. So if we can get in those nutrients within that window, fantastic. And if you're managing your weight, great. But a lot of my patients struggle with that window.
It's also pretty antisocial having one meal a day.
100%.
So we had a little discussion before this, and you said that the number one thing, well, I guess supplement that you prescribe is iron. Why? How would people know that they're iron deficient? And, I guess what is the benefit of supplementing with iron?
So iron's job is to transport oxygen to your brain, your muscles, your organs. And so the patient that I see often comes in with extreme fatigue, brain fog. They just feel like they can't concentrate. And oftentimes when I check their iron, we see that they are iron deficient. And usually in these patients, they are producing very small red blood cells. And oftentimes, if not dietary, we would then need to supplement. However, it may be dietary, it may be a GI bleed for some reason, it may be a heavy menstrual cycle, and that's why they're losing iron. So we need to understand why. Why are we losing iron in the first place? And then in those instances, I would then supplement.
If you're looking for an iron supplement, I would recommend blue iron. I am low in iron genetically, and I really struggle with iron deficiency. And I love blue iron because firstly, it's liquid and it tastes great. It's made with Nordic blueberries. Secondly, you can take it with or without food. So a lot of iron supplements you have to take on an empty stomach. And then also it doesn't make you constipated, which is a bonus because a lot of iron supplements do make you constipated. So give it a try. It comes in original, pregnancy, kids, and sport. So if we were to say a perfect eating plan and supplement regime, I guess supplementation is quite personal.
Yeah.
But in general, what do you think is a perfect day?
In terms of supplements?
And diet.
In terms of nutrition, I would say, again, because I'm in the space of personalized nutrition, an example would be 3 meals a day. Please eat, because we need to eat to produce so many hormones. Our body doesn't work in isolation. There's so much going on. So 3 meals a day, making sure those meals contain enough protein, enough fiber, you're just not eating enough vegetables, and obviously enough healthy fats like your extra virgin olive oils, your avos, your fatty fish. Added to that, again, it is personalized. We'll check bloods, we'll see what the person needs and appropriate dosage. However, I will always say magnesium. Magnesium is my favorite mineral supplement. We all living very stressful lives, and magnesium can drop very quickly compared to the rest of the nutrients. Magnesium, vitamin D. I've got a lot to say about vitamin D, but vitamin D and a vitamin B12.
I love it when someone says they've got a lot to say about something. So you've opened the door.
Yeah.
Vitamin D, tell me.
So most of the patients that I see, my patients that struggle with thyroid issues, endometriosis, PCOS, we already know we've got a high incidence of vitamin D deficiency, myself included. So When we look at vitamin D on a blood test, there's a normal range and then there's an optimal range when we look at functional medicine. And oftentimes those patients need to be heading in that optimal range space, which is a lot lower than a conventional range on a blood test. And we know that in every cell, there's a vitamin D receptor, which means vitamin D plays such a crucial role in hormone production, cellular processing, brain health, immune system, inflammation, glucose control. So it's a very important fat-soluble vitamin. Now, depending on the patient, I would give a specific dosage, and we want to see every 3 months to see if we're overdoing it because it's fat-soluble, it stores in the liver, so we don't want to go overboard. But oftentimes my patients are vitamin D deficient and they're not aware of it. And so checking that, supplementing appropriately. Yes, you get vitamin D in food, but not barely enough if you're deficient.
So you say check every 3 months. Why 3 months?
So I check every 3 months because I need to see, am I giving the appropriate dosage? If not, we increase. Because there's a toxicity level, we decrease depending. And I'm with my patients for a lot longer period because these conditions are quite complex.
So 3 months is a good time frame in order to reassess.
I find doing it every 6 months, my patients love numbers, and it just keeps them motivated. Oh, I'm on this program, my nutrition is improving my biochemistry, same with my supplements. It's just motivating as well.
So I'm going to backtrack to the diet because I think a lot of people are interested in this. And when you say enough protein, enough fiber, enough fats, like how long is a piece of string, you know?
Exactly.
So what is enough protein? And also this protein conversation actually drives me mad. Because everyone is very protein pro at the moment.
I think it's social media and just human nature that we take things to the extreme. Again, it depends on my patient. So the recommendation is 0.8 grams per kgs per day, and that could look different for everyone. And for menopausal females, going up to 1.6 grams per kg per day is important for muscle growth. And so the protein varies depending on the person's physical activity, their nutrition, their deficiencies, it varies. But when I say eating enough protein, I mean eating enough protein, fiber, healthy fats together in every single meal. I don't mean we have to supplement with protein, having protein shakes throughout the day to get in enough protein. It's just everything in combination, and how that looks is different for everyone.
Okay. So say for instance, someone's 70 kilos and we're doing 0.8 or 1 gram of protein per person just because it's easier maths. So we're having 70 grams of protein in a day.
Yes. So that could look like, in a day, that could look like 2 eggs in the morning with a quarter cup of cottage cheese. That could look like a chicken breast for lunch, and that could look like a piece of fish for dinner.
Okay, so on average then, each meal has about 25 grams of protein if you're looking at fish, chicken, and eggs.
About 21 grams
of
protein.
That's good to know. Fat. So again, everyone is all about olive oil and how healthy it is, but the calorie amount of olive oil is huge. And when I see my husband go like this with the olive oil all over a salad, I'm like, oh, it's not that healthy. So what's your opinion on olive oil?
So olive oil, it's great. Olive oil has vitamin E. It's got an antioxidant called oleocanthal. Fantastic, very high in antioxidants compared to the other oils that we have. However, I do teach my patients portion control. So if you're having fat at your meals, it would be about 2 teaspoons in your specific meal. It would be 2 teaspoons of extra virgin olive oil, as an example, or 1 tablespoon of reduced fat mayo, or a quarter avocado. So portion control is important.
Okay, so you can't have cheese, avo, and olive oil.
I mean, you can if you're not worried about your weight, go ahead. But if we are trying to maintain a weight, then of course portion control is important.
Okay, the killjoy. Magnesium. This one is particularly advanced and interesting because it is liposomal. So it means it is highly bioavailable and absorbable by your body. It is a liposomal citrate, so it supports muscle health, bone health, promotes sleep, relaxation, and provides cellular absorption. Use the code CouchConversations to get 100 Rand off your order. Okay, so my next question is snacking. What is your take on snacking? Because again, a lot of people will say don't snack because it causes these blood sugar, I guess, variations throughout the day. Rather let your body rest and digest in between meals. And it also, I guess, helps you to calorie control. What's your opinion on snacking?
Again, it depends on the patient, but if you, I mean, we do genetic testing as well. We look at the TAS 3R2, if I'm not mistaken, gene, and some people have a higher affinity to want to snack and others don't. As long as it's within your calories within your day, I don't see a problem with snacking. However, let's say we have glucose control issues, so type 2 diabetes or insulin resistance. I always teach my patients to pair their snacks because we know pairing your snacks are going to reduce that spike and dip. So I'll say dress your carbohydrates. If you're having a fruit, have it with some nuts. Or if you're having some crackers, have it with some tuna or cottage cheese. And so it's all about understanding how you can pair your foods to improve a blood glucose. And if someone is not a snacker genetically, then fine, they can get their nutrients within their 3 main meals.
I love that you brought that up because I actually wanted to bring that up because the glucose goddess is also very popular on social media. And she talks about, I guess, sequencing your meals. So starting with fiber, salads, then moving on to your protein and then leaving your carbs for last. So is there science to that? And do you agree with that?
There is science to that. However, is it practical? And so that's usually when I'm giving advice, it needs to be practical because patients are going to be doing this for a very long time. And so asking someone to eat their veg before their carbohydrate at every single meal, it's not realistic.
Just pass the bread.
Or pass the bread to your partner. But it's not realistic to, and sometimes we have stews and we have soups, now what?
Yeah.
It's just, it's great information, I understand, but practicality.
Yeah. So I struggle because we'll dish up and I always have salad or veggies and then, my main meal. And if I eat my salad first, my meal is cold by the time I get there. So I struggle with that on a daily basis. What happens if you eat it all at the same time? So if you're like one bite of salad, one bite of pasta, one bite of does that make a difference?
All fine. So again, if I'm teaching my patients to make sure that they have all their macronutrients on one plate, eating it together makes for much better glucose control than having carbohydrates on its own. Right? So it's fine. Have a little bit of everything. It's also about enjoyment.
Totally. And I think people get too stuck in the fine details. Okay. So is there anything that, like one, I guess, crucial piece of advice that you can give to someone who's struggling with their weight, number one? And then I guess another crucial piece of advice for someone who's really struggling with this energy dip in the afternoon. It's usually around like 3 o'clock, 4 o'clock, where you're just like, ugh, I've still got 2 hours left of my day. And then you're generally reaching for something sweet to pick you up.
Correct. I must say, what I see in practice is a lot of people, number one, they don't know how to eat. And so already, if they're not eating enough, they are going to want sugar at 3 p.m. in the afternoon. And so if we're trying to manage your weight, before we get into the specifics of nutritional requirements and what you need to get to your specific outcome, that is what I like to tell my patients. I don't put you on a diet. I teach you how to eat before we add in those specific requirements, because nutrition, physical movement, sleep management, stress management, repeating nutrient deficiencies, all of that together is going to give you the best outcome. And so it's so individualized, but nutrition is the foundation of all of it. And so understanding how to eat is really important.
Okay, so what I'm hearing is portion control is key if you're wanting to lose weight. Eating enough is key if you want to lose weight and if you want to avoid those energy slumps.
Correct.
And I guess planning your plate with carbs, fats, and proteins is also incredibly important, because if you're only eating carbs, then it's probably not going to sustain your energy
100%.
enough. And same with fat. You kind of need that combination to really keep you stable throughout the day.
Yeah.
So Kirby, as a dietitian, you see a number of different patients, and I guess we're looking for one key take home or one key piece of advice that our viewer can take home with them.
What I will say is, on the flip side of everything that we've been discussing, I also find that a lot of patients tend to over supplement. And so my last piece of advice would be test, don't guess. Because we can be very specific and personalized when it comes to a better supplementation schedule versus I'm taking B12 because my energy is low and I'm hoping that that's the reason why. And so I think test, don't guess is an important one to remember.
So we all know that sulforaphane is my favorite. So my question to you is, do you use sulforaphane? And in what context would you ask people to consider the supplement?
So yes, I do. I do use sulforaphane. We know that sulforaphane is incredibly important for detoxification of the liver. And so again, when we look at a genetic test, we can look at phase 1, detoxification, phase 2, and we know if there's any issues in terms of those phases, we can add sulforaphane to help improve detoxification and elimination. And so if we're looking at endometriosis, for example, we know that some patients are estrogen dominant, and we also know that some of these patients struggle with constipation. And so adding in sulforaphane to help with the breakdown of those estrogens and then having them go to the bathroom regularly to eliminate those estrogens becomes very important. We also know that you can get sulforaphane from food, so all your cruciferous veggies, your broccoli, your cauliflower, your Brussels sprouts. I know genetics will say eat them raw to get the most sulforaphane, but again, we can supplement. It's much easier.
Amazing, thank you. So we've spoken quite a lot about B12, but I guess having a full spectrum B complex can also be beneficial, particularly for this mid-year slump.
100%.
You know, we're now in October. We've still got to keep our foot on the pedal because we're not at the end of the year. We can see it, but we're not there yet. So energy is you know, I think a pain point for most people. So would you recommend a B complex in order to help with this energy boost?
A B complex is good. I would often recommend a methylated B complex, because we know, again, if you bring it back to genetics, I wouldn't know if the person methylates well. And so getting a complex methylated B12 supplement, we know it's more in its active form, it's better for absorption. So that would be an option. Because we can check B12, if you are extremely B12 deficient, then obviously the dosage may need to be a little bit higher. But I think a B12 in general, a B complex in general is a good option. And then obviously nutrition.
So an activated B12 or activated B complex, or methylated in the scientific term, that your body can recognize and absorb with, even if you have genetic variations.
Correct.
Our Biomax Vitamin B is one of our customers' all-time favorites. It is an activated B complex, so your body can absorb it and recognize it. It is liposomal, which means that it is highly bioavailable and time-released. and you can use the code Couch Conversations to get 100 Rand off your order. So a lot of athletes are, I guess, struggling with energy as well, particularly endurance athletes, high intensity athletes. So are there common nutritional shortfalls you see with athletes, and what supplements do you generally recommend to those individuals?
So magnesium is a good one. Magnesium glycinate is great for muscle relaxation and recovery. We also know that you may require more electrolytes, and so adding some electrolytes into your water, your sodium, potassium is great as well for muscle recovery and muscle pain. And then we also know that athletes, because they're doing more than the average individual, they can be iron deficient, and so again depleting if necessary.
So I just want to ask on the electrolyte thing, because
Yes.
again, this is all over social media. Would it benefit you taking an electrolyte every day, even if you're not an endurance or you're very athletic?
Yes.
And then I also understand that 1,000 milligrams of sodium is, kind of what sets a good electrolyte apart from a not so good electrolyte.
Again, very individualized. But what we know about electrolytes is electrolytes almost force your water molecules into the cell for optimal hydration. So if I'm saying you need to have 2 liters of fluid per day, you still may not be hydrated. So often, depending on the patient, I'd say, well, add in some electrolytes, sip on it throughout the day. Please don't down it all at once because you can feel very dizzy. And again, it's a lot of sodium and potassium, so you want to sip on it throughout the day and sip on it throughout your physical activity. So that's important. Now, if a patient comes to me and they've got high blood pressure and then they are taking extra sodium through a supplement, then we'll have to be cautious because we don't want to up their sodium intake. So if a patient has high blood pressure, I wouldn't supplement with an electrolyte because we know sodium can increase their blood pressure. So it's really individualized.
It's so confusing to me because I've always been taught that salt makes you dehydrated, but yet when you are taking a hydration stick or an electrolyte, it's got 1,000 milligrams of sodium. So it's completely counterintuitive to me.
And again, in that space, it's very individualized because if you're struggling with water retention and then the high blood pressure, of course, we don't want to exacerbate that problem. But also, we know that minerals are so important for cellular function, and most of us are so stressed, so overworked, and lack in energy. And so, it can be a nice pick me up and actually improve energy.
So everyone, I hope you've learned a lot. I certainly have, and I hope I've, tried to ask all the questions that answer your social media questions, because we're so bombarded by what we hear, what we need to eat, what supplements we need to take, what we need to focus on. So thank you, Kirby. I think you've debunked a lot of myths for us and added a lot of value. So thanks for joining us, and I look forward to discussing more in the future.
Awesome. Thank you so much.
Please remember to like our video and share if you find this content interesting. Also, feel free to ask us questions and recommend any speakers that you would like to see on the show.